we have three wonderful practitioners on the call tonight. All three have significant experience with sleep apnea and Inspire therapy, as well as other treatment modalities. The first is Dr. Marty Trott. Dr. Trott grew up in Buffalo, New York, and he received his undergraduate and medical degrees from the University of Rochester, and then trained at Cleveland Clinic. In 2010, he earned his Master's of Medical Management at Carnegie Mellon University and is the medical director for St. John's Health Physician Practices. He is very passionate about cost-effective and care and compassionate care of children and adults for ear, nose, and throat problems. In addition, he is particularly interested in methods to improve complex healthcare systems. He studied cello performance at Eastman School of Music as a fun fact, and also considers himself to be a terrible skier. We also have Dr. Haven Malish on the call tonight. Dr. Malish is board certified in sleep medicine and pulmonary disease. Dr. Malish completed his medical education at the University of Hawaii and then did two different residency and fellowships at the University of Southern California and a sleep fellowship at Mayo School of Graduate Medicine in Minnesota. And then finally, we have Bey Zecher, nurse practitioner, on the call tonight as well. She's newer to the sleep clinic, but not new to Jackson. She moved to Jackson 3 years ago from Colorado, but originally hails from Connecticut. She did her undergraduate nursing degree at the University of Vermont and her master's in nurse practitioner program at Simmons University online. She loves to hike, run, raft, and ski, and enjoy all of the other outdoor activities that living in Jackson, Wyoming offers. So with that being said, we're going to go ahead and kick it off here. Just a quick reminder that anytime throughout the presentation, you can ask a question using the Q&A button at the bottom of your screen. All you have to do is hover your mouse over the bottom half of your screen, click on the Q&A conversation button, and type your question into the chat. And somebody may respond to you during the call, but if not, we're going to address all Q&A at the end of the presentation tonight. So with that being said, I'm going to turn it over to Dr. Malish here to give us a little bit of background on sleep apnea and some of the initial treatment options for it. So Dr. Malish, it's all you.
Okay, I'll jump right in. First slide here is a depiction of someone with obstructive sleep apnea. You can see two different arrows there, the one more to the left, and then the one more in the center. They both are arrows that should be going all the way in down to through the airway into the lungs, and you can see that those airflow stops because the back of the throat is collapsed, and that's what sleep apnea is. It's collapsibility of the airway, where you have obstruction of airflow, hence the name obstructive sleep apnea. And so that's the basic mechanism that causes low oxygen and disrupted breathing. Over 20 million Americans have this in either a moderate or severe form. So it's there's a lot of cases out there, both diagnosed and undiagnosed. Next slide, please. Okay. I think you missed part of that. There was the half. Yeah, there you go. The bottom right there was the part missing. So that airflow, when it stops, you can see in those apnea episode 1, that's 47 seconds, and then that blood oxygen level, it usually should be in the 90s. It drops to 84% because the airflow and the oxygen can't get in, and on the second one it drops even further to 74%. So and that's your body likes oxygen to be higher than that. Next slide, please. And so one of there's many results of untreated obstructive sleep apnea. Fatigue, decreased executive function, decreased productivity, more prone to accidents because you're more sleepy, and it can disrupt the bed partner's sleep as well, because it often is accompanied with snoring. And so the bed partner often gets just as bad of a night's sleep, not worse, as that the person does with sleep apnea. And on the health side of things, severe health consequences, heart attack and stroke, or heart and brain issues, tend to be more prominent. It's a risk factor for those things occurring if you've got untreated sleep apnea. Next slide, please. And so the gold standard of therapy is CPAP. That stands for continuous positive airway pressure. And so that's just gentle pressure going into your airway to keep everything nice and open, just like if someone blows into a balloon and just gently keeps it slightly inflated. That's what CPAP does, is it goes on your mouth and keeps your neck and the lungs kind of inflated so that those obstructions don't happen. It is great when it works, but a lot of patients just can't tolerate it. Next slide, please. Okay, and so there are other treatment options, and this I'll hand over to Dr. Trott.
Thanks, Ivan. So I'm Marty Trott. I'm the ENT doc, and I am the Inspire implanter. But any of you who work with our team will realize pretty quickly that our goal is actually to not do surgery if at all possible. I saw, I think, 5 folks today that were looking for Inspire in the office, and a couple of people are moving forward to the first step, which we'll talk about. But there are other options. I referred one person for an oral appliance, and you can see that depicted up in the upper right-hand slide there. That is a picture of, essentially, it's sort of like a retainer that you'd wear as a child, but it allows us to move the lower jaw forward. And as you were shown in the beginning of the presentation, part of the problem people have sleep apnea is their tongue falls backwards. And since their tongue is attached to the lower jaw in the front of the jaw, if we could pull the jaw forward, that can be effective in some patients, typically those with mild sleep apnea. This is usually not effective for moderate or severe sleep apnea. And the reason I never liked sleep apnea in residency at Cleveland Clinic is because we really didn't have a lot of good solutions. Almost all of the surgical solutions we have are what we call anatomy altering surgery, like taking stuff out, like taking the tonsils out or removing the uvula. And what we're typically doing in that, where it was the only option we really had other than putting a tracheostomy and bypassing the airway altogether, was we were trying to remove statically, like all the time, stuff when there's really only a problem at night. Even people with severe sleep apnea don't typically have any apnea or any symptoms at all during the day other than the consequences of the sleep apnea. So people are obstructing and snoring at night, unless they're really severe and fall asleep during the day, typically don't have any symptoms. So the question, the way Inspire was effective is that it works dynamically only when people are taking breaths in. And I'll explain that here in a second. So let's go on to the next slide. So Inspire is an implant. You can see that depicted on the left. Just like a pacemaker, it looks a lot like pacemakers for the heart, but instead of putting it on the heart side, which is on the patient's left, we put this on the right side. And this is off during the day. It has no impact on anything, although if you put your hand over your chest, you can feel it on the right side. And then at night, there's a little thing that looks like a mouse, which is the device that activates the Inspire. And there's a latency or period of time between when you activate the device and it starts working. So when people fall asleep very quickly, we set it to a fairly short latency, meaning you turn it on, it might start working 5 minutes afterwards. And in people who have trouble falling asleep or want to read, they know they want to read before they go to bed, we may set it for 40 minutes or 60 minutes. So that's completely adjustable. It has to be adjusted in the office, but we work with patients. Bey works with them and my office works with them if Bey isn't available. So I think, Aaron, if you hit the button here, we can show how this works, how you activate it. So this is a patient who's got the Inspire implanted and a little device, which is adjustable. And we set it to be adjusted for folks that it will work. We actually set it up when you first come into the office to the lowest setting that will start to move your tongue forward. And over time, we adjust it so you can move it forward. So this works. There's a sensor lead, which is depicted on the right, which goes between the ribs. And then there's a battery. And then ultimately there's a wire that goes up under the skin to the back of the tongue where we can attach it to the nerve that moves the tongue forward. And that's what I need to do during the time of an operation, which takes about an hour and a half. And we'll talk about that in just a minute. So during the day, this thing is off. During the evening, it's on, and it works by sensing inspiratory effort. You go to breathe in. That's the time when you're snoring effectively or your airway's collapsing. And at the time you're doing that, it moves the tongue forward. So I've had some patients come into the office, they thought it's something we just maybe clip on their tongue or something that's like pretty minimal. It's not a massive operation, it's an outpatient operation, but it's not something that we want to do lightly without people failing conservative therapy. And you'll find working with Bey and working with Haven Malish and working with me, if people can tolerate CPAP or BiPAP or any of the other positive airway pressure devices, that is the preferred therapy. Although honestly, we see a ton of patients who can't do it, and that's why they come to our office. So let's go on to the next slide. So Inspire is a safe outpatient procedure. I have done, I think, 64. I should have about 70 done by the end of June. So it's placed through 2 small incisions, one between the second and third rib on the right side. Typically, there's reasons sometimes to put it on the left. For instance, if someone's had breast cancer or there's something else on the right side. And there's a second incision that goes parallel, nearly parallel to the jaw, slightly less than 2 inches against the chin, under the chin. The operation from start to finish typically takes about an hour and 15 minutes to an hour and a half. I've not kept anybody overnight in the hospital, and all 60 plus patients that we've had. Patients rarely use pain medications. There are some, maybe 1 in 10 or 12 use pain medication short term. And while we used to have a 3 incision approach, now we've done it through 2 incisions. It's a lot easier to move to back to regular activity, as long as you're not skate skiing or doing push-ups in the gym on post-op day number 2. Pacemakers that work for the heart, of course, work all the time. So they have about a 5.5 year battery life expectancy. The Inspire device has an 11-year battery because we're only using it at night, of course. And if it needs to be replaced, it's quite easy to do in an outpatient procedure. MRIs, so this device is what's called conditionally approved for an MRI. MRIs can safely be performed on the head and the neck and the extremities. And for the time being, until the FDA rules on this, people can't get MRIs of the shoulder. So it's one of the things I discussed. One of the talks that you'll have if you end up deciding to work with our team. I spend a lot of my time telling people, answering their questions. I also tell them a lot of reasons why you shouldn't have it. And one of the potential reasons is an MRI. I've not had anybody not do that because of the MRI issue. And I tell them you can theoretically get infected, you can have potential complications, but we haven't seen any of those problems. Let's go on to the next slide. So after the operation, so we're doing one this Friday, and then typically 30 days after the procedure, after it's completely healed, you'll come in to have it activated. And this is kind of a depiction of what happens at that visit. What I do though, but before that visit, is I see people in the office, or at least do a televisit to make sure the incisions look great. So when you come in, either Bey or Dr. Malish or I and Celeste in my office will take a look at you, make sure that everything's moving properly, and what we call interrogate the device, see how it's working, make sure it's working properly. And then we set it up to the lowest amount of energy that will allow your tongue to move forward. And we give you settings at home that you can go from lower settings to higher settings. Pretty straightforward. And there's a ton of great information on the Inspire Sleep website. And of course, you guys can call us at any time if you have any questions. And ultimately, you just leave with your device, started on level 1, and over time, typically I say this is a marathon, not a sprint. Over 2 to 3 month period, you move up from lower energy levels to higher energy levels. And you'd think that sometimes more power would be better, but that's not necessarily the case. And this is adjustable in a lot of ways. So if people don't like the way it feels for whatever reason, it's not an electrical shock sort of sensation. It's more of a tongue movement sensation. So if people don't sleep well at night and they don't like the way it feels, we have a lot of adjustments that are available. Let's go on to the next slide. So why would we do this? This is clinically proven. This is, and our data, my data, our team's data looks just like this. Average AHI, which is the apnea hypopnea index. You guys have been probably given a number. When you go in for those sleep tests, either a home sleep test or office-based sleep test, we measure how many obstructive events per hour people are having. Normal is 5 or less, and mild goes up to 15. Before Inspire, the average was 29.3 per hour. And after Inspire at 6.2, and Aaron and I were just looking at our data today, and ours looks identical to this actually. So 79% reduction on average, if you take all patients across the board, in event reductions. Let's go on to the next slide. This is probably important for bed partners. And this is not a reason to have the operation, but a lot of the secondary benefit is there's a lot less in the way of snoring that occurs. So before Inspire, 83% of patients were reported as snoring by bed partners. After Inspire, 10%. Next slide. What do patients think? I'll tell you, I mean, I actually I had the opportunity last year to go to Germany. One of the biggest implanters in the world is in Munich, and I worked with him for like 3 days. And he said of the 300 or so implants he's had, he said nobody wanted out. And my general philosophy is, even if people aren't using it as much as they want, or if they're not using it at all for whatever reason, which is very uncommon, we tried not to take these out because it just puts people at additional risk. But in the original STAR trial that was looked at, that people got FDA approval for, 94% patients are satisfied, a couple more like kind of neutral, and rarely there's someone who is basically unsatisfied. I haven't seen that. I've seen people that I divide people into those that are like immediate winners. They turn it on, they're fixed, instantaneous resolution of snoring, complete resolution of sleep apnea. They feel awesome. And then there's other people that it takes time for their body to get used to having the tongue movement sensation, or they need adjustments of the device. This data on the right-hand side of the right-hand part of the slide, it shows how many hours per night people typically use this. Our data is actually better than this. Our patients use this about an average of 6.4 hours per night. And as you guys probably remember, the Medicare rules or the insurance rules, you have to use CPAP so many hours per night or they take it away from you. So we don't typically have a problem with people using it because it's if you're going camping, you just take your remote control with you. And that's one of the reasons we see people back in the office. I think one of the things I always talk to folks about is this is just like having high blood pressure or diabetes or any other chronic medical condition. This shouldn't be a one and done. I've had patients so psyched, like they turn it on, they're cured. We have trouble tracking them down. But what I think the better way to do this is to be seen at least once a year. We interrogate the device, make sure it's working properly, look at how often you're using it, making sure the connections between the device and the different wires are working properly. Let's go on to the next slide. This is kind of already getting old data. This is when I first started doing this I was trained in March of 2020, basically the week that the entire country shut down with COVID. Did my first case in June of 2020. And at that time, there were maybe 100 of us roughly in the United States doing this. Now that about 600 physicians have been trained to implant the Inspire, probably more, only about 200 of those are doing 2 or more implants per year. So there have been many patients that have gone through this, and I've not run into any issues with insurance coverage, Medicare, VA, commercial insurance like United, Blue Cross Blue Shield, Cigna, and it's usually fairly quick. My bigger problem is actually patients coming in and seeing us on a Monday and then wanting to have the implant done on a Friday. So that's kind of unrealistic. I mean, there's certain steps that we need to take, and we'll talk about those in a minute. On to the next slide. So who is a candidate for Inspire? I saw someone today who had mild sleep apnea. So if you have mild sleep apnea, you're not a candidate for Inspire. That's one of the advantages of this area. A lot of people are super health conscious, and I think we're identifying sleep apnea more here than other places. So you have to have moderate to severe sleep apnea. You have to have unable to get consistent benefit from CPAP, either CPAP intolerant or it's leaking, or have people that gulp air because it gets down into their stomach. There's what we say by not significantly overweight. There's a BMI or body mass index, which is a measure of height and weight. Typically less than 35 is ideal. And the reason that we pick this number is not just completely arbitrary or random. It's actually related to the likelihood of the device working. And then there's an airway exam that occurs, one airway exam we do in the office. And some of this I do actually by telehealth. So I've seen patients by telehealth initially, and then we see them for the what's called second airway exam, which is done in the operating room. So it's kind of a 3-step process. You have to have a sleep study that's been done within the last 2 years, typically for most insurance. You either enter the system by seeing Dr. Malish or Bey, or you come to our office and see me, or see me by telehealth. We look at the different data that's available. We assess whether you've had a tonsillectomy or not, and whether you're able to breathe through your nose. And the next step is what's called a sedated endoscopy, where we bring folks to the OR for about a 5-minute sedated exam. It's not an operation from the standpoint we're cutting anything. We're basically looking and making sure the airway collapses in a way that the device could benefit the person who's getting the device. You know, it'd be really bad to put an implant in that didn't work. So we rule out maybe 1 in 10 patients for this. And it tends to be the patients that are heavier on average. The other thing is patients need to be 18 years or older unless they have Down syndrome, and then that's experimental, but also showing great success. And at the bottom it says, if you haven't had a recent sleep study, you may need a new one. We typically look, I saw someone today who had a sleep study, clearly has sleep apnea. I mean, been on with difficulty CPAP, taking it off every night after 1 or 2 hours for about 6 years, but no recent sleep studies. So we've made arrangement for them to get a home sleep test because their insurance is going to need that to get this approved. Let's go on to the next slide. One of the places you can find a lot of information, I direct people to this all the time, is the Inspire Sleep website. So you go to inspiresleep.com if you guys haven't found that yet. Really helpful. Talks about, there's an insurance section, there's patients ambassadors who are not paid to try to convince you to have surgery. There are people that have undergone this. I think my biggest referral network actually is patients now that used to go out and camp with people that had, and they all were arguing about their CPAP, and now someone's showing up without CPAP and not obstructing. So there's people like this on the inspiresleep.com website, and you can submit questions there, and you can always, of course, call our office. Let's go to the next slide. There's also an app on the phone that you can get a lot of information if you are a smartphone user, and you can watch instructional videos if you have any questions. But typically patients, we're a pretty tight network in Jackson. We see patients from all around Wyoming and Western Idaho. And typically we have patients call us if they have any questions. But if you need to have any questions answered, that information is available on the Inspire Sleep app on either Google Play or Apple Store. Let's go on to the next one. So why St. John's? I can tell you, I've worked here for 15 years. It's a great hospital. We are, we've won multiple awards, but I think it's really the personalized service. I trained at Cleveland Clinic. You can go to the Cleveland Clinic and have this procedure done in Cleveland, Ohio. I know who's doing it there. He's a great doc, but it's going to be more of a large system experience. And what I do with all my patients, whether they're Inspire patients or they're having tubes for their kids, is the first weekend after surgery, I just give them my cell phone number and ask people to text me if they have any problems or questions so I can get back to them in a timely fashion. And for those of you who might be coming from outside the area, we're located in an awesome spot. Let's go on to the next slide. So people often ask, how can they get to us? My wait list is probably about 4 weeks right about now. Bey's is a little bit quicker. So if people haven't had a sleep test, you'll sometimes enter through the sleep department. But to call my office, this is the number 307-739-7690, and we'll leave this up for you. We also have a website address where you can find information. Celeste's in my office can be really helpful. Even if I'm not in the office and I'm in surgery, we typically don't take more than 24 hours to get back to people who call. And on our website, that's stjohns.health/Inspire Sleep, there's a form that you can fill out that you can enter, like, when did you have your last sleep study and who's your family doctor and what's your BMI? And then we can take that information to get back in touch with you.